Hi, I'm Dr. Raymond Douglas of Beverly Hills, California, and I'm an oculoplastic and orbital surgeon. I'm going to talk today about the second segment of blepharoplasty or periorbital rejuvenation in patients who have prominent eyes. So in the first segment, we discussed about what causes prominent eyes, and if you have prominent eyes, what you can do about it. In the second segment, I want to talk a little bit more about the under eye bags that many people have and want to do something about, and even the upper eyebrow and upper eyelids, and how conventional surgery can be rather risky if not done by an oculoplastic and orbital surgeon who's very in tune to patients who have prominent eyes. So in the first segment, we talked about moving the eye back. Well, what that does in moving the eye back is it tends to improve the lower eyelid contour. And what I mean by that is that the lower eyelid often looks sagging and drooping. And we have some examples of that where especially the outer corner of the eye just begins to sag over time. And this can be improved by moving the eye back, but it also often requires a small surgery to either tighten the lower eyelid or to lift the lower eyelid, depending upon the circumstance. And this can be quite predictable and really dramatically improve the youthful appearance of the lower eyelid. Sometimes we can even take away a little bit of skin, but you have to be extraordinarily careful in taking away any skin of the lower eyelid in patients who have prominent eyes. The other question that many people ask is, what can I do about the lower eyelid bags and tear trough area? And the lower eyelid bags and tear trough is something that is really tough for patients who have prominent eyes because it often gives dark circles, and a standard blepharoplasty is kind of the worst thing that you can possibly do because it can often cause eyelid retraction and a very unappealing appearance. One technique that we will do is often to inject a little bit of filler or fat into the midface, but also to do a blepharoplasty where you take the fat that's kind of bulging forward and transpose it over the cheek and kind of build up the cheek at the same time and create a very smooth appearance and very smooth area underneath the eyelid. The upper eyebrow and the upper eyelid can also be problematic and start to sag over time. And when patients' eyes are prominent, just removing skin of the upper eyelid can actually make this appear worse. So we concentrate on improving the brow contour and sometimes even adding a little bit of volume in around the brow just to make that a very appealing appearance. Even temporal wasting, and this is the temple, and a little bit of filler through that area can dramatically give more balance to the upper eyelid and reduce the appearance of tiredness and drooping of the upper eyebrow and upper eyelid. So I hope some of these have been very useful. And please see our website that details a lot of patients' journeys and how they've achieved a really nice improvement and improvement of their aging changes over time. Thank you very much, and please subscribe to our YouTube channel if you like our content.